Assalamualaikum to everyone. My name is Nur Sarawati and today I would like to present my case study. The title is Early Detection of Diabetes Mellitus Type 2. First of all, this is the patient background. The patient are known as Mrs. S, 55 years old, a housewife with BMI 30 kg per meter square. She is physically inactive, living with sedentary lifestyle, with unhealthy diet and uncontrolled food intake. She complained that she had experience of painful urination for the past 3 weeks with excessive sweating, thirst, and excessive urination at night. The doctor undergoes few tests such as full blood count, HbA1c test, blood glucose test, urine FEME test, and renal function test to investigate the patient condition. This is the lab diagnosis. First is full blood count. Mrs. S full blood count test results show they are normal reading for all its parameters. Next is HbA1c test. Mrs. S result show high level of HbA1c which is 15%. Then the random blood sugar test show 20.3 millimole per liter which is also high. This is urine FEME test result. This result show that the color of urine is yellow with slightly cloudy. They are also present of blood 3 plus and glucose which is also 3 plus. This renal function test show that there are no any abnormality on all its parameter, and this is show that renal function test result on Mrs. S are all normal. Based on the lab result, the FBC test show normal reading. However, Mrs. S random blood sugar test reading show 20.3 millimole per liter, which is abnormally very high compared to the normal range, which is supposedly less than 11.1 millimole per liter. Even though random blood sugar reading are influenced by meal intake, with Mrs. S abnormally high result in random blood sugar test, together with the classic symptoms of high blood sugar that she experienced, such as excessive thirst and urination at night, this show that Mrs. S has a high possibility of having diabetes mellitus. Doctor proceed with HbA1c test for the confirmation of diabetes mellitus for Mrs. S. HbA1c test is a test that provides information about a patient's average level of blood glucose over the past 3 months. Mrs. S HbA1c result show abnormally high result, which is 15% compared to its normal range, which is between 6 to 8%. By referring the HbA1c result, the doctor diagnosed Mrs. S with diabetes mellitus. This is because the level of HbA1c are not influenced by the daily fluctuation in the blood glucose concentration, for example due to the meal intakes, and this made the HbA1c test is one of the best indicators for diagnosed diabetes mellitus. The urine FEME test show yellow color with slightly cloudy of urine with the presence of both glucose 3 plus and blood 3 plus in the urine. Abnormally high amounts of sugar in the urine are known as a glycosuria. Glycosuria is the excretion of glucose into the urine. One of the most common causes of glucose in the urine is diabetes mellitus. The excess blood glucose levels cause the kidney difficult to properly reabsorb the glucose and can cause it to leak into the urine. The presence of blood in the urine are known as hematuria. The microscopic examination showed that there were roughly in average of 70 to 80 of red blood cells in the screening field. The presence of blood in Mrs. S urine may be cause of the trauma from the presence of high amount of glucose that accumulated and passed through the urinary tract. Renal function tests were done to examine the effect of diabetes mellitus towards the renal condition. Mrs. S result on renal function test showed a normal reading for all its parameters. with the sign and symptom that Mrs. S showed, such as heavy excessive sweating, excessive thirst, which is known as polydipsia, excessive urination, which is known as polyuria, together with all the result gains such as high level of random blood sugar, high level of HbA1c, urine FEME test showed glycosuria without the presence of ketone, then the doctor finally conclude by diagnose Mrs. S with diabetes mellitus type 2. Even though both diabetes mellitus type 1 and type 2 show the same classical sign and symptoms with the absence of ketosis in the case of Mrs. S, together with the age at the onset, this showed that Mrs. S are having diabetes mellitus type 2. Having a sedentary and inactive lifestyle, the likelihood of developing diabetes mellitus type 2 for Mrs. S are high, as one of the common factors of diabetes mellitus type 2 is being inactive. Diabetes mellitus type 2 occur when there are ineffective using of insulin due to the insulin resistant or the body itself unable to produce enough insulin for glucose metabolism, in which both of these conditions will lead to the high level of glucose in the blood. After the doctor diagnosed Mrs. S with diabetes mellitus type 2, the doctor prescribed Mrs. S with 500 mg of metformin to be taken 1 tablet twice a day. This metformin works by improving the sensitivity of body tissue to insulin so that the body uses insulin more effectively. With a proper management of diabetes mellitus type 2 will help in reducing serious life-threatening complications. Management of diabetes mellitus type 2 can be focuses on lifestyle intervention. Self-monitoring of blood glucose for the people with newly diagnosed with type 2 diabetes may be used in the combination with education to get a clear understanding about the disease in order to create awareness on the negative complication in their life. Exercises and a proper diet that promotes weight loss are also the foundations of diabetic care. A great amount of exercise will provide a better results. For example, aerobic exercise leads to a decrease in HbA1c level and improved insulin sensitivity. To conclude, even though family history, hereditary, and gene mutation play a role in development of diabetes mellitus type 2, when the individual's life is in active and healthy lifestyle, it can reduce the risk in developing diabetes mellitus type 2. Finally, prevention is better than cure. Thank you.